Brought to you by the medical professionals at Carpal Pain Solutions, developers of the Carpal RX.
If you have hand or finger pain, numbness, and tingling, you probably have carpal tunnel syndrome. And right now you might be considering surgery, whether by endoscopic or open release surgery. Your considering surgery is a major decision, and you should know all of the facts as you make that decision. Key information for you to have are to know what factors will almost guarantee surgical failure. And by failure, it means either no relief of symptoms, return of symptoms, or complete dissatisfaction with the surgery and its results. The first factor that will almost guarantee surgical failure is if you have severe symptoms. If you have extreme pain, numbness and tingling, and these symptoms wake you up at night. Another factor that will almost guarantee surgical failure is if you have diabetes, even if your diabetes is under control. Another factor that will almost guarantee carpal tunnel surgery failure is if you are obese, which also is a major risk factor for having carpal tunnel syndrome in the first place. Hypertension or high blood pressure, whether controlled or uncontrolled, is another risk factor for almost guaranteeing a failed carpal tunnel surgery. If you suffer from depression or are under emotional stress, your carpal tunnel surgery results are also almost guaranteed to fail. Finally, if you are an alcohol abuser or drink heavily, your carpal tunnel surgery results will also likely fail. The end result of a failed surgery is that your symptoms will be back, and then you'll have to deal with them all over again, along with a constant visual reminder of the pain, loss of job time, and financial burden a failed surgery has caused you. So it's not surprising to find out that most people who have carpal tunnel surgery are unsatisfied with their results, but the overwhelming majority of people who have non-surgical therapy are quite satisfied. Knowing all of this, you'd naturally say, what's my reason for having surgery when I can use a non-surgical therapy option instead? So before you consider surgery, why don't you join the thousands of people who have used the Carpal RX and have said, I canceled my surgery? Testimonials continue to pour in from around the world, like that from Marlene.
I was considering hand surgery, but thanks to the Carpal RX, I canceled my hand surgery and now I'm pain-free.
The Carpal RX completely cures the symptoms of carpal tunnel syndrome in 93% of patients. So you owe it to yourself to try this remarkable product and take advantage of the 60-day free trial offer with every Carpal RX. The Carpal RX is so successful because it uses deep tissue massage therapy and produces the same motions as a therapist when treating carpal tunnel syndrome. The result is that pressure due to swelling is removed from the median nerve, and this results in a reduction of pain and other symptoms. The Carpal RX always has a 60-day free trial. If you're not completely satisfied with your results, you can return it for a 100% refund, including return shipping costs. The Carpal RX is guaranteed to permanently and easily get rid of carpal tunnel syndrome, wrist tendonitis, and repetitive strain injury. Visit the Carpal RX at carpalrx.com.